this is Annie Shreya, host of the day, and you're listening to Little Warriors by Dr. Stalin Ramprakash. I welcome you, Doctor.
Thank you.
So, this episode, we're going to understand about the procedure of bone marrow transplant for thalassemia. So, this is especially for those parents who are looking for the preparation of bone marrow transplant and how you would understand about this journey. So, doctor, could you tell us what does this procedure look like on a pre-procedure of transplant, during the transplant, and post-procedure?
Yeah, so bone marrow transplant, even though the word transplant comes, it is not a surgery, it is a medical treatment, but it is a little long treatment. So there has to be a phase called pre-transplant preparation where we will be doing some investigations for the patient, donor, and then get the patient ready for transplant. And then there is an actual transplant procedure where they will have to get admitted in the bone marrow transplant unit. And then after everything is okay and the patient is ready for discharge, we will discharge the patient. But even after that, the patient will need to have a prolonged follow-up. We have to do regular follow-up and blood tests and investigations. So it's a bit a longer process. Yeah.
All right. So, doctor, could you tell us, while we break this down, how does this procedure look like on pre-transplant?
Yeah, so whenever, as we are, if somebody is listening to this, probably they have already been told about the bone marrow transplant for their child. So in thalassemia, we have to get the patient ready for transplant first. So that means if the patient is not in a good shape, so when I say not in a good shape, for example, if they got severe iron overload, or if the liver and spleen is big, if those kind of situations, we have to do certain level of preparation so that we reduce the risk of the transplant procedure itself. So this may depend on how the condition of the child is. It can vary from sort of 1 or 2 months to even 6 months to a year to get the child ready for transplant, because it is better to fully prepare and then go for a transplant with the least risk as possible rather than going aggressively and doing the transplant urgently and have a bad outcome. So that is the first thing. So in the pre-transplant phase, so we will do some blood investigations for the patient and donor to make sure that the donor is in a good shape, and also they will not transmit any infection or anything to the patient, and they can tolerate the procedure of the stem cell donation or bone marrow harvest. And then for the patient, we need to do some investigations to make sure that the patient is in a good shape to sort of undergo the procedure. And then nowadays, and for most of these thalassemia transplant, we also give a little bit of treatment, what we call as a pre-transplant immunosuppression, before actually doing the actual transplant. So it may vary between 1 cycle or 2 cycles, sometimes even 3 cycles, based on what kind of transplant we are doing. So this phase may last for 1 to 2 months, and then the actual bone marrow transplants comes across.
All right. So, what can the parents expect to see during this procedure of transplant?
Okay, so during the transplant procedure itself, once we have cleared all the pre-transplant stages, and also we have to fully explain all the procedures and what are the risks, benefits, and everything to the parents, and they will have to sign what we call as an informed consent form. So that is, they need to understand why the transplant is being done and what to expect out of it, and what is the short-term risks and long-term risks, short-term benefits and long-term benefits. So with all this understanding, then they will have to sign for the consent. And then when we actually admit the patient for bone marrow transplant in the BMT unit, they will have to stay in for somewhere between sort of 40-45 days to almost 2 months, depending on the type of transplant. So in the first phase, in that admission, what we will do is we will be giving some medications to bring the immune system of the patient down, so that they accept the cells from the donor. And also we have to give some medications to remove the stem cells, or basically make a room for the new cells in the bone marrow, removing the old cells. So that phase lasts somewhere for between 7 to 10 days. And after that, we actually give the stem cells from the donor. And so like I might have told in the previous things, the stem cell giving is just like a blood transfusion. It just goes through the vein, and then it will go and settle in and start making new cells. And then once that is given, usually the most vulnerable period, or the more sort of risky period of transplant is it from the time of stem cell donation to the next 2 to 2.5 weeks. So because that is the time when the immune system is really down and the patient is also not making any cells because we have destroyed their bone marrow, and the new cells which are given, it takes about 2 months 2 weeks to start working. So in that in between period, there is a risk of infection, there is need for repeated blood transfusions, platelet transfusions, and so that is the most riskier time. Once the new cell starts coming, then the patient starts feeling much better, then the risk starts going down. So usually, so the patient will stay after the stem cell infusion for about sort of 3 weeks to 4 or 5 weeks, depending on whatever complications or anything happen. And then once the new cells come and the patient is stable and they don't need any injection medications, they don't need any blood or platelet transfusions, then they will be released from the bone marrow transplant unit. So usually for children, usually one of the parents will stay with the child throughout, and majority of the time the child is going to be okay. They'll be just sitting and watching TV and doing stuff. There will be a sort of couple of weeks where they may become unwell, which we'll have to deal with it.
Okay. So, doctor, could you tell us what should the family consider as on the risks and benefits of this transplant?
Yeah, so because the transplant is a serious procedure, it is true for any medical procedure. So whenever you will get choices of whether to do that way or go this way. So when you are going for a bone marrow transplant, so there are short-term risks, long-term risks, short-term benefits, and long-term benefits. That is what families have to weigh in order to make a decision. In majority of the situations, in a young child, always the benefits outweigh the risks.
Okay.
But because this is a serious procedure, there is a small risk of even mortality, that is death associated with the procedure. That's why the family has to think carefully about it.
Okay.
So when we talk about short-term risks, during the transplant, the patient can become very unwell because of there will not be any white cells to fight infections. They may need a blood and platelet transfusions. So that is usually a period of 2 to 3 weeks, and maybe up to 100 days post-transplant. And when you talk about long-term risks, the main long-term risk is about the infertility, which they have to consider whether that is okay for the family. It is not that every single child will be infertile, but they should be ready for the child being infertile if they have to take this call of going for a bone marrow transplant.
Okay.
But the benefit is that however well done the conservative management of regular blood transfusion and iron chelation medication, over a period of time the disease catches up. So beyond a particular point, their life is not normal. They do start developing complications one by one, say some liver problems, some infection. Sometimes the transfusion requirements starts going up and up. So instead of getting blood transfusion every 4 weeks, it may become 3 weeks, and then 2 weeks, and then 10 days. Once it reaches that stage of uh, needing excessive amount of blood, there is no way we can save the patient, because the amount of iron which is going in will be too high, and we cannot take out at that stage. And then bone marrow transplant is not an option at that stage. So that is why if the patient is in a good shape, they can live for a very long time, but once they start deteriorating, things just go out of control. So the benefit of the transplant is, once you do a transplant, they don't need any blood transfusion, so this kind of long-term deterioration doesn't happen. And also the patient is off all the medication. Actually, this is one of the things which is very different from, say for example, a kidney transplant. So a patient who had a kidney transplant will have to take lifelong medication to keep that kidney okay. Even then also the kidney may fail after, say, 10 years, 12 years, and then they need another kidney transplant. Whereas bone marrow transplant, once it is a success, usually by 1.5 years, we take off all the medications. So the patient is completely free of medications for the rest of their life. So they are like everybody else. So, and more importantly, something called quality of life is a very, very important factor in all the patients. So almost after the bone marrow transplant, the quality of life goes back to normal or near normal, if you like. Whereas it will not happen in a regular thalassemia management. The quality of life will keep going down and down and down. So that is the long-term benefit of bone marrow transplant.
So, could you tell us what do these first few days would look like on a post-transplant procedure?
Yeah, so I always tell the families that there are a lot of milestones you need to cross in the transplant.
Okay.
The first milestone is getting discharged from the bone marrow transplant in a good condition. So the next milestone is 100 days, that is 3 months post transplant. So because that is the time when the immune system is really down and it slowly keeps coming up. So by the time you reach 3 months, your immune system is reasonably good, so that you can fight off most of the infections. So then your risk is significantly goes down. So immediately after the discharge, we normally see the patients in the outpatients department twice a week for the first few weeks. After that, they will go to once a week. And then, so there is a lot of adjustment in the medications, tests needs to be done, some adjustment in the treatment needs to be done. So that will keep on going on. Around 6 months to 8 months, if everything is okay, so we'll start reducing the medications. And if everything goes fine, somewhere between 9 months to 1 year, the child will be off all the medications. So once the child is off all the medications and the child is doing well and the donor cells are working well, and that is that situation, we say that everything is okay. For the child to say 100% completely back to normal, it usually takes about 2 years from the transplant. So most of the children who are going to school, so that first 1 year they will not be able to go to school.
Okay.
Maybe after the 1.5 years or something, then they may start going back to school. And once they start going back and there is no long-term issues, they are essentially normal like any other child.
All right. So could you tell us what is the most sensitive phase that the parents must be aware of?
See, the most difficult phase in the transplant is in the first 2 weeks of transplant. At that time, you will be inside the BMT unit. So you are constantly with the doctors, nurses, and everybody. So every little thing is taken care of, and so you have got a lot of support at that time. And another thing is that we don't allow visitors into the BMT unit. So that is the one thing the family may find it difficult. So the child is there for 45 days and the mother is also there for 45 days.
Okay.
And they cannot come out and nobody can come from outside to inside. I mean, the room has got all the facilities like TV and everything, but still you are almost like living alone.
Right.
And but all the nursing staff and other people will be there to help. But that takes an emotional toll. So, and sometimes there is another child in the family, so the mother is worried about that child, what is happening to that child, and who is looking after, and all those, so many other factors will come into play.
Right.
But it is a difficult thing, but it is a very short period, and eventually when the child becomes completely normal, then the whole family is like back to normal like any other family.
Okay.
Other than having a lifelong medical illness with the family.
All right. So when exactly do things finally feel like, okay, they're stable?
Yeah, so usually sort of when we stop all the medications, because a lot of the medications are given to suppress the immune system to prevent a complication called GVHD. So once we remove all the medications and then we have to revaccinate the patient, like how a newborn baby, we give the vaccinations in the first year. Similarly, after the transplant, we have to keep giving vaccination. It's almost like you are wiping the slate clean and then restarting. So the immune system is restarting from scratch. So you will have to give the vaccinations. Usually, sort of we say after the first 2 doses of vaccination, the child can go back to school. So around sort of 2 years from the transplant, so almost everything goes back to normal.
All right. So looking back, what helped these families actually go through this phase?
Okay, so see, I think here we have not talked about the cost of the transplant, but the cost of the transplant is a major issue for the families, because and most families think this is a very, very expensive treatment. It is an expensive treatment, but so we have to see that what is the cost of thalassaemia treatment, even if you don't do a transplant. Actually, in most of the, even in developed countries as well as in developing countries, many of the studies show that a cost of transplant is equivalent to the cost of normal treatment over a period of 6 to 7 years. And that doesn't stop at 6 to 7 years, it will keep on going. And as older and older the patient becomes, the cost of treatment will keep on increasing. So when you consider the cost of treatment of transplant, you have to consider what is the cost of treatment without transplant. Even though it is spread over a long period of time, mostly the cost of treatment without transplant will be 5, 6, 7 times higher than the cost of transplant. But
Okay.
only problem is in transplant you have to spend all the money upfront at the time of
Right.
transplant. So that is one. So that
Mhm.
takes so a lot of the families, that is the stress they go through.
Right.
But thankfully, there is now a lot of the avenues available, and sort of we have also empaneled with a lot of charity organizations, including Call India. So if there is a matched sibling who is going for a transplant,
Mhm.
actually we can bear majority of the cost of the transplant, as opposed to the family bearing any cost of the transplant. Okay,
Right.
there is only very little they will have to organize. But
Mhm.
if it is a matched unrelated transplant, then the money they have to spend will be a little bit more. And if there is a haploidentical and half matched transplant, I think a significant proportion of the cost has to be borne by the family, because at present there is not enough support for this half matched transplant from other agencies.
Right.
So, but for a fully matched sibling, actually in our hospital we will raise most of the money for the patient.
Okay.
So that is one part. So that is
Mhm.
the cost part of it.
Mhm.
So what the family stress they undergo. The other
Mhm.
one is the emotional component.
Mhm.
So, and so most of the times these families come for transplant from somewhere else.
Mhm.
So they may not even belong. They're not Bangalore or even other states. Sometimes they come from international, from another country. So coming to a new place where they don't know anybody, they don't know the language, and then they have to go through this serious medical procedure, that takes a
Mhm.
toll on the patients.
Okay.
So most of the time we try to help these patients by having some interpreters and people who can speak their language, and
Mhm.
all those things, taking care of their accommodation and things like that. So that is also another issue. And then sort of the emotional angle, so that is where there is more problem, because of so like I said, one child, sometimes they will leave the child with the grandparents, or they are in a new place, father has to go back to work because they have to keep the family running.
Right.
So many things, because 6 months in an unknown place is quite a big
Yes.
task. So it has to be planned correctly.
Mhm.
Sometimes somebody else can come and stay with the mother, some say grandmother or relative or somebody who can stay, so the father can go back to work. So
Okay.
we give all the different options, and sort of the family to choose what is best for them.
Okay.
Yeah.
All right. So thank you, Dr. Stalin. I believe this would have given the parents a clear picture of what to expect during the procedure of a bone marrow transplant in thalassemia.
Thank you very much.
Yes. So if you're someone who's looking for a proper clarity and a good picture, I hope you have understood this journey and this will help you in little less overwhelming feeling. So you're listening to Little Warriors. This is Annie Shreya, host of the day, signing off, and we'll see you in the next episode. Thank you.